Good morning. Welcome to our last council meeting of the academic year, and graduation is right around the corner on May 23rd. And for those of you who have come to graduation, you know how special it is and how terrific it is to be there. So I encourage you all to come, please, and represent the council. And no doubt we will hear from a number of speakers, and Senator Schumer hopefully will be there, as he always is. It's always a treat to hear his
You're going to give a speech for him?
Speech. Well, we're webcast now, Lou, so I wasn't going to say that, but you could say that. But in any event, welcome. I want to welcome, in particular, two new and one returning councilman. We have Mayor Jean Garant with us, and it's such a thrill to have her here. I had a wonderful discussion with her. I knew her by reputation before I actually met her, and her reputation is terrific. She's a successful businesswoman. She's a distinguished public servant, and we're thrilled to have her. I know Shirley is thrilled to have her. Thanks to Shirley and the relationship she's built with the community, we don't have too many issues that we have to deal with, but I'm sure whatever challenges we have in the future, Shirley will sit back and say, Gene, you want to just go out there and talk to the community and calm those folks down. So that'll be very, very helpful. Thanks, Gene, for being here. And Gene's husband, Phil, is also a member of the faculty here at the dental school.
Correct.
We're thrilled to have him as part of our family as well. Dr. Len Benedict is with us, a prominent OBGYN physician in Nassau County. He's on the Nassau County Hospital Board, I know that, and a whole bunch of other honors and things I'm not going to repeat, but his most distinguished credential is his son or daughter is a medical student now? Son is a medical student last year, I believe, right?
Yeah.
Last year medical student at Stony Brook Medical School. So he's been part of our family even before he's been part of this family. So we're happy to have Len here. And returning, because he just can't get enough punishment, is Andrei Antonenko, our graduate student representing the graduate school this year. As you know, there's a rotation among the 10th, I shouldn't say the 10th, could be the first, but there happen to be 10 members. One of the council members is a student. They rotate between undergraduate and graduate student. It's the graduate students rotation. At the last meeting, we talked about possibly being changed, so there's an undergraduate and graduate. That requires a change in the law. We sent a letter to interim Chancellor Clark. I had a conversation with John. He seemed supportive, obviously supporting it and getting it done and changing the law are two different things. And again, there are all kinds of issues. Maybe you do it for the 4 university centers, and you don't have to do it for the, because we do have, obviously, at the university centers, a disproportionate enrollment of graduate students relative to the other campuses. So that's, with that said, if we can just make a motion to move the minutes.
So moved.
Okay with that, we'll move the minutes. I will now turn it over to our president, and as I do that, there have been a number of significant milestones at this university since Shirley has been president. But it's hard to pass. It's hard to get over the one that happened several weeks ago, which was the Simons gift. I know Shirley's going to talk a lot about that, but when you have $60 million, when you have a $60 million gift, it's a hard act to follow. But listen, make no mistake about it. When a donor, particularly a big donor, and this is beyond big, gives money to university, they are giving money to the president. They are giving money to the president of the university, the president's vision, what they see and what they trust the president is going to do with those funds. I mean, pure and simple. We'd like to say yes. Jim was the chairman of the math department here, and he's been incredibly successful in his field, and he's always been good to Stony Brook. But a gift of that magnitude is a personal gift. It gets made because of his relationship and his faith with the president. So you can't say, we can't say enough good things about our president, but the good things keep coming, and we want to congratulate Shirley, and it really deserves a little round of applause. With that, Shirley, you're on.
Yes, sir. this 50th has really been a kind of magical year. You know, usually you sort of think of what can you do to celebrate the 50th. And in a lot of ways, the things that we've been striving for 50 years have come to pass this year. And it is a very exciting time. One of the things, of course, that we've been working on is this $300 million capital campaign. $300 million in 5 years, which is, you know, it started at maybe 150, 250. We got it up to 300 because I really believe you have to stretch goals, and it's better to go for 300 than not make it than go to for 150 and make it. We are in danger, in serious danger of hitting the 300 a year ahead of time. So thanks very much to Jim's and Marilyn's gift. That event, by the way, in which Rick represented us and spoke very movingly, was in fact a very moving event in many ways. Jim talked about how the university had given him a job when he had been fired and needed a job. He'd been fired for protesting the Vietnam War. He was 30 years old and came here to be the chair of the math department and built this great math department we have. And Marilyn spoke of how she came here as a freshman when her brothers were bricklayers building the campus. And she got her chance at, and her father was a bricklayer, got her chance at an education, went on to get her PhD, went on to meet her husband here. And, you know, that story, the story Marilyn told, and we all got very lucky.
She was crying when she told the story. I mean, it was unbelievable.
Is what Stony Brook is about. It's what public higher education is about. It's giving people that one shot that they wouldn't have otherwise. And when you see who our alumni are and what comes out of it, it is very, very special. And certainly to have them give back in the way that Marilyn and Jim have given back really is very moving. It is the largest gift that SUNY has ever had. When we got the Charles Wong gift, that was the largest gift SUNY had ever had. And so, and actually, to tell the exact truth, Jim is going to be giving, has already said he's giving more than the 60 million because things keep growing in this project, and this project will be done perfectly. It's very exciting. Jim has been 100% involved in the planning with the other mathematicians and physicists. He is in fact working on a mathematical paper with one of the mathematicians, Dennis Sullivan, who's world class. So it's the sort of project you love because it gives the donors such joy, and it certainly gives us such joy. Very special part of our 50th anniversary. We have also been moving ahead on two very important concepts, and now with the impending change of the governorship, we can only hope that Governor Patterson continues with the directions that Governor Spitzer had taken, because he had made it clear that higher education was his top priority. We have the report of the commission, which is very important. He had embraced the idea of 2,000 additional faculty for CUNY and SUNY, of having very special research faculty for the research institutions. But beyond that, he had designated Stony Brook and Buffalo as flagship campuses. And in the past, SUNY had never used the F word. And that is very important to us, because if the state begins to support the flagships as flagships, it will make a tremendous difference. Right now, we work on the same formula as all the state colleges in the system. And it's very important. It is absolutely right to choose Buffalo and Stony Brook. Buffalo upstate, we're downstate. We are the only two institutions that are in AAU, which is the top 62 research universities in the country, almost exactly half of which are public, half of which are private, so the Ivy League institutions, etc. And that is measured on such things as the number of federal dollars that we bring in, and again, Buffalo and Stony Brook, particularly when you look at the federal dollars that come from peer-reviewed research grants, are rather than earmarks, which is what AAU counts. We are by far and away what happens to bring money in for research, and that is a measure of the quality of our research. Together, we probably represent 2/3 of the funding that comes in for the 64 campuses. So it makes sense. It also makes sense because if we establish the principle of flagships, then I think like California, other institutions then will be able to move into that category. I really believe it will lift all those. So I'm certainly hoping that determination will continue with the new government. In New York, it's one of the few states that does not have a distinguished recognizable, it's two great states that does not have a distinguished recognizable state university system, and that's because we don't have flagships. You think of Michigan, you think of Ann Arbor. You think of California, you think first of all of Berkeley, then UCLA, and then San Diego. They've added, there are actually 7 of them in AAU. You know, you think of Texas, you think of Austin, and it really helps to get people and the government involved in the entire system. So the thought that no, we want to keep everybody equally miserable will not work to lift this university to become a great university. And I think that was a very important step. The other very important new initiative is the alliance that you may have read about between Cold Spring Harbor, Brookhaven National Lab, and Stony Brook. Now, interestingly enough, that too really began with Jim Simons, whose idea it was. I wish I could take the credit. But to get the state behind supporting that alliance is brilliant, because you put together those 3 institutions. There's no place else in the country that has that kind of constellation, a federal lab, a state university, and a private lab working together on, we're going to work on genetics, on cancer, on neuroscience, and bioinformatics, which are all places where the 3 of us have very, very special strengths. And one, I think, stunning example has already arisen before we really got into this, give us some funding to work together, and that is that one of our researchers working at Cold Spring Harbor and using the imaging, extraordinary imaging facilities at B&L, has for the first time been able to create an image of a neural stem cell. Brains create new cells, and she was able to get the image of this, which is an extraordinary feat that's been a great deal of publicity on that around all the scientific journals. So that's another very important thing for us to move up the next level. Our research gets lots and lots of attention. You're going to hear about some of it today. I suppose my favorite lately is the devil toad. Have you been reading about the devil toad, the fossil from Madagascar? from the late Cretaceous that was a frog or toad so large that it could crunch on small dinosaurs. And that got so much attention that it even showed up on Saturday Night Live. Now that's funny. So that's really, it hit everywhere. It's very interesting. But lots of exciting research going on, and really if we can take this next step to the state supporting us to be a research institution, it's going to be enormously important not only for us but for the state. If in this alliance we are able, because we also here have represented Nassau and Suffolk counties, to bring our state legislative delegation together to support this. It too will be very important because that's not usually the way Long Island works. I came to Long Island from Queens. It's very much the way Queens works, and there's a lot to be gained for everybody. If people agree they're going to support these, and you're, you know, in Long Island, your 9 senators and your assembly people together support those. So that is, I think, those two things are enormously important to us, and I hope that all of you will work with us to move those two agendas forward, because they're going to make more difference to this university than anything else can. The president of Buffalo and I are working very closely together in talking to people and explaining what this does for the state, etc. In your notebooks, you have the 5-year plan, which is our looking forward now. We've had 2 previous 5-year plans, both of which were, how do we fix what needs fixing? And now we're at a point where those things are fixed, and our job is, what do we do looking out? I began to think that the 5-year plan was called the 5-year plan because it was going to take us 5 years to finish it. It has taken more than a year, more than the 5th year of the last plan to get it finished. But I think it is very important. You'll see in the front the 12 initiatives, and then you see them spelled out. What we do in our 5-year plans is to say, these are the things we're going to do in the next 5 years. They are by no means the only things we're going to do, because some things we can't anticipate. We don't know if Brookhaven is going to be up to have new management, for example. But whatever else, we're going to get these things done in these 5 years. We put them on a matrix of what we're going to do each year. We let people know who are responsible. It is not a rolling plan. At the end of each year, we do a scorecard on what we've done or haven't done. And obviously, almost always, we've done what's to be done in that year. And so this is really our plan moving forward. We have, by the way, gotten a lot of attention from other places because as you look at it, you'll see it's very solid and specific, and it works. So that's where we're going from here. We are, April 9th is our big gala. We're going to be honoring Nancy DeZenas this year, who is the head of the Roush Foundation that did the Long Island Index. It's going to be a great party because it is also our 50th anniversary and celebrating that. So we hope you'll all come. And we also make a lot of money for scholarships, which is a good thing.
Look.
Mr. Chairman, with the President's permission, and being from Texas, I know she'll understand this, the one great attribute of all universities is a great football team, and we have a problem because the other flagship has already reached Division I, we're 1AA. I think it's really, and very seriously, it's a very, very important part of our growth to have a great football team. And just like in high school football, everybody knows the high school coach's name, but nobody knows who the principal of the school is. And so at the University of South Florida, a former SUNY provost, took over there, is now becoming famous, not so much for the work she's doing in South Florida, but because of her football team and so forth. So I say this sort of with tongue in cheek, but I think maybe Mr. Simpson might want to give a few $1 million for more seats in the stadium.
Well, we are going to put more seats
I know
in the
that,
stadium.
but we have to be legal, we have to get up
But
to 30,000.
also, we're winning more than Mr. Simpson is. So.
Pardon?
I said we're winning more than Buffalo is, so there is that.
But that's going to change, by the way. They brought in a great #2 Heisman Trophy candidate to coach the team, and he brought them into the top of the MAC, which hasn't been done in 20-some years. So we've got a competition in many areas.
Well,
I'll try to handle this one.
And the marching band.
Pardon?
And the marching band.
That's right, we have the best marching.
The marching band, unless you have the marching band.
I'm sorry. That's
You can't have a
great
Division I
oversight on my
football
part.
team without a
But
Division
we're
I marching
we're
band.
well on the way to being, because we have a better marching band than Buffalo has.
That's right, that's right. Let me say, you will see that those of us who work in these parts are wearing red because we have Red Fridays. We're also changing our academic garb. We're going to have red robes at commencement this year. And the first students, the students who were here in the first year, are going to have gold robes and march in the procession of graduates. So it's going to be a good end of the year as well.
I should have, in my introductory remarks, I should have introduced Joe Antonelli, who's the president of the Undergraduate Student Council. Thanks, Joe, for being here. One of the hidden jewels at Stony Brook University is the School of Dental Medicine, and while relatively small by the standards of most dental schools, it is certainly one of the most productive. And Shirley referenced the research that's being done at the university. Some of the most important, and certainly some of the research that's gotten the most attention and has gotten translational value into really providing better health care for people, has been at the dental school. So we're very pleased that Dr. Israel Kleinberg, Dr. Lauren Golub, and our own Dr. Maria Ryan are here to talk a little bit about what's going on there. It's always exciting to hear about the great things that are happening all over campus, but in this case we're going to hear about some of the great things at the dental school, the research at the dental school. Thank you, gentlemen, and Maria, for being here. So whoever wants to go first?
I guess with those very nice complimentary remarks, I think maybe we should quit while we're ahead. Before going into our presentation, there's just a couple of comments I wanted to make, which I think might help you understand a little bit the overall process. As you all know, after the Second World War, there was a tremendous expansion in basic science research. And most of that was to turn out professors and so forth to accommodate the baby boomers that we've heard about and still continue hearing about. And if you look back in time, what you find is that there are these cycles. And there's periods where there's tremendous advance in the basic, and then there seems to be sufficient to accumulate that applications start to come. One of the milestones as to when applications should come was an important act that was passed by Dole, the two senators, in 1980. And what they did was they passed an act that enabled the universities to have the rights to the intellectual property that arises as a result of the research. And as a consequence, the universities generally moved somewhat slowly into application. In fact, because of the way the university had been developing and so forth, there tended to be somewhat a bit of a snob attitude by those doing basic science research, and that applied was getting your hands dirty. Of course, that has changed, and changed very dramatically. And what has happened is the recognition has come is that applied research is very important. It has tremendous importance for the survival of this country and its competition with other countries throughout the world who are recognizing that if they're going to get the better jobs, etc., all that sort of stuff that you hear, read about in the newspaper, they have to be very actively in this area. It so happens that we got interested almost from the beginning, when a lot of that basic science was developing, we got interested in application. So in essence, as I think you will agree with me after we complete our presentation, that we are approximately 20 years ahead of the curve. And so, without saying it further, I just wanted to be aware of that as a background. We'll start with the first one. Now, I may be pretty good in the other lab, but I'm not very good with this. I'm told that I'm supposed to press the mute.
You hit it twice. Just hit it.
Twice?
Yeah.
Okay. All right. Now, as you see here, what we have title in the title is the term, let's get this one right here, translational oral biology and its impact on the future, and here's the three musketeers that are involved. Now we're starting from the oldest guy, somebody that's a little bit younger, and then of course the beauty in the room, but a top scientist. Now the term translation is something that's used more commonly today, but it really deals with applied research. And I think you'll see that from this next slide. Oh, I've got to remember to press there. And this is the diagram to set out the process of translation. In essence, and this is specific to oral biology, but it's fairly general. The three components, the so-called ABCs, this is the basic aspect, and what it deals with, as well as some of the medical biology, and it deals with new knowledge discovery. And then the next step, you're all aware of this, is that you then move into the translational process. And here the focus is on applied technology and also knowledge development. I'll comment about that in a moment. And then ultimately, it's brought to the clinic, where we have clinic application, and that deals with application of A and B to the delivery of health care. Now, translational oral biology has two legs: technology transfer, knowledge transfer. Technology transfer is what you hear about. It's all about patents, etc., and so forth, what have you. The actual hardware that you need. But this has been largely neglected. Now, what's so important about that, from this whole translational process, is the fact that you can come up with great discoveries, and you discover that the professionals who should use it, the consumer that use it, don't know how to use it, don't know how to go about it. And as a consequence, what you have is a gap of anywhere from 30 to 40 years between the time when the discoveries are made and they get applied. We recognize this very early in dentistry. We recognized it very early when dental school was set up here. And one of the things we did is we introduced very early was a course called Translational Oral Biology. And that's to start dental students in 3rd and 4th year take that. As far as I'm aware, it's the only course of that type in the world. Now, the thing that's important here, you see, is that this involves, and these are the things that we built, not only is it the teaching of the dental students, but it's also the teaching of who become the teachers. And accordingly, we have combined programs in place, which involves the dental degree with a specialty, the dental degree with a PhD under the umbrella of oral biology, but you basically can do a PhD in translational oral biology here at Stony Brook. Okay? Okay, now what I'm going to focus on now is essentially the scope and status of the translational oral biology products related to dental caries and oral malodor. here, instead of going into much of the science, etc., I want to take you to the very end of the process, which is products. The process consists of initially publications, patents, but ultimately it's products. So let me start taking you through on my end of it, which deals more with the dental caries and a few other aspects, and then Dr. Gull will take you through other aspects thereafter. Well, first of all, Proclude, Prophy Paste, Denclude, toothpaste, both approved by the FDA. It's for sensitive teeth. They're toothpaste. This one is to plug the open tubules, which is responsible for the sensitivity, and this is to ensure that they are closed. And the thing about it is that these now these were developed by a new startup company, which was Ortec, and has been licensed, sub-licensed to Colgate-Palmolive. And that is going all over the world. And at the present time, the market size in the USA for that is $400 million. Okay? Now, this is related to that. This is just a little bit behind. And what you find here, this Cavestat, the Prophy paste, followed by Cavestat toothpaste, is the following. It means in the very early stages of the caries process, when you're getting some of these demineralizations, you can fix them without putting in fillings. In other words, if you have something going wrong with the wall, some erosion or what have you, you spackle it. And that's why jokingly we refer to this, is that you spackle it. And you reinforce the spackle with the toothpaste. The market size in the US, toothpaste, is $2 billion. Worldwide, it's $5 billion. Dental caries is the most prevalent disease in children and one of the most prevalent diseases in humans. Now, there's another aspect product that we've taken to the market, which is Smart Mouth for malodor. It's to deal with the microflora in a way so that they don't produce putrefactive products. And Smart Mouth is available now in 30,000 stores throughout the United States. And that includes Walmart, includes Duane Reade, includes Target, etc.
Is that its brand name too?
That's correct. That's the brand. It's for oral malodor. Now that's fairly easy to take to market and get approval because it's cosmetic. But it's also important for controlling the bacteria associated with periodontal disease. Now, the market size of this mouthwashes is about $1 billion a year. Okay? Now we come into the interesting one, which is basic mints for early caries prevention and treatment. One of the big problems, and where the caries is most prevalent, is in the pits and fissures of the teeth. And in the pits and fissures of the teeth, you can't get your toothbrush into there. They can get, the lesions can develop fairly rapidly and extensively. And consequently, one needs a way how to tackle them. So once we discovered Cavestat, which is the active ingredient, which really is synthetic saliva or concentrated saliva, we said, okay, what we will do is do the same technique which causes the cavities, which is that candies get stuck in there and the bacteria can make acid, etc. So if you get Cavestat mint or candy stuck in the teeth, it will now make the region alkaline and it'll fix the cavity. And before I leave this, I should mention, we just completed a clinical trial using these mints, and with 4 mints per day, 2 in the morning, 2 in the evening, 70% reduction in dental caries. The market size for candies, and I got the figure just yesterday just to check on it, is $112 billion per year. These are the kind of numbers that are involved. Okay? Now let me take you to the next one, which happens to be a cariometer. Originally, we used to call this the Exploratron. What's happened is now in the whole caries field is try to get the lesions before they are cavities. If you go into a dentist's office now, takes a probe, and he sees if he can find some holes. He takes the X-ray machine and so forth and sees if he can see holes. You cannot see the early lesions with either. So consequently, we developed electronic means of being able to do that, and that goes hand in hand with the spackling, etc. That is now, we've completed the clinicals, and that is going to be now shipped for production. In other words, to start getting it manufactured. Because it's a device, an FDA approval will probably take something like 6 months. If everything goes according to what our experience has been, in 1 year, they should be starting to sell. I hope I don't sound too much like Wall Street. No, I better not say that. Now, this is just to give you an idea. You see here on the left, you can see here there's some staining and so forth. You're not sure whether they're cavities or not, or might be beginning and so forth. And then here's what happens when you take them in. Now, if that were a candy, that'd be sitting there, and the acidity would be just building up and so forth, and you progressively get a cavity. Instead of that, you repair the cavity, you prevent it. Now, here's the, I'll get used to it yet. Now, this is the name that we first used was Exploratron. The trademark was too close to Explorer, so we changed it to the Carryometer. This developed, constructed, everything done here at Stony Brook, because we have the shops to do it and so accordingly. But you can't see the tip and so forth, but let me show you what the implications are. If you take a tooth, and you slice it like so, okay, you get rid of the top slice and so forth, and lo and behold, you find, look at, here's the demineralizations like this, okay? And then if you continue to go on with the slicing, you see how far it has penetrated, okay? Further down, in this particular case, it hasn't gone down to the 4th layer, and here you're getting close to the pulp. What you have now is tunneling. You get cavities that are tunneling. You can't see them, you can't find them, and as a consequence, there are a lot of people losing their teeth and getting root canals, etc., when they don't need them. Okay, having said that, now, what happens with other dental products? We continue here with the secondary consumer and professional products that will incorporate Cavstat technology. Dental floss, some mouthwashes, toothpicks, intraoral strips, medicaments for sealing pulp exposures, restoration and preparation of liners, sealants that have a tendency to leak and so forth. This takes care of that, and so forth. This is responsible for a couple of $1 billion in market. Now, also, gum products. There's gum products, pet products, because there are pets that do get cavities, mellow, etc. And here's a one that's kind of sweet, which is jelly beans, boiled hard candies, caramels and toffees, chocolates and other coated confections, mini pastry, biscuits, etc. That's all places that one could introduce Cavstat. Now, a lot of science went into it. It sounds easy once you've got that final product. That final product took over 30 years to arrive at. It's really taking saliva apart and taking it apart and finding out what it was that gave saliva that tremendous ability to protect against cavities. And as a consequence, we got into an area of mixed flora metabolism. Everybody said we were crazy because everything was with pure cultures and so on. And consequently, we find that so much of it applied in other areas. This one I'm sure you'll like, Phatastat, manipulating the intestinal microflora for obesity. And there's been some recent studies on obesity with mice that confirms our concept. But we can build the models, and we started building models for it. And then we have Vagistat, manipulating the vaginal microflora. That we've substantially done. Dermastat, this for various aspects that will apply models of the skin flora. And TumorStat is something that has arisen out of some of this technology. I won't go into that, although it's one of the most fascinating. Because if we are right, and I know I sound brash in this, we could have the answer to cancer in a couple of years. If we're wrong, well, at least we tried. And then there's Xerostat for those who have dry mouth, and I'm sure some of you had that, and we usually can tell that by the fact that the tremendous amount of bottled water that's sold. I think that takes me to my end. And now, what you do is Dr. Gallo, and he's going to tell you about other very exciting stuff. He's the inside man.
Thank you.
Well, I was told that I have to stick to a very strict 5-minute schedule. So already I feel pressured for time. But thank you very much, Dr. Kleinberg. Well, as a bit of history, over the past several decades, my team and I here at Stony Brook have been developing a new chemotherapeutic approach to the inhibition of collagen breakdown. And collagen, of course, is the major structural protein of all of the connective tissues of our bodies, including skin, bone, tendons, ligaments, cornea of the eye, cartilage of the joints, and so on. And because collagen is virtually everywhere in our body, it's not that surprising that any new therapeutic strategy which can inhibit collagen breakdown might be expected to have widespread medical as well as dental therapeutic implications. Now, basically, what we discovered was a new use for an old family of drugs. The old drugs are the tetracycline antibiotics, and what we discovered is a previously unrecognized ability of these tetracyclines to be able to block these collagen-destructive enzymes produced by our own body cells and tissues throughout the body, and during a variety of medical and dental diseases. And as a result of that, we embarked on 2 therapeutic strategies to develop new drugs. And in the first of these strategies, we deliberately chemically modified the tetracycline molecule by stripping away some of the side chains of the drug, which are known to be responsible for the antibiotic activity of the drug. We eliminated the antibiotic activity, which we considered a nuisance factor, and we ended up with a series of chemically modified tetracyclines, which were no longer antibiotic, would no longer induce antibiotic side effects, but still retained their ability to block these collagen-destructive enzymes or collagenases. And originally we developed a series of 10 different chemically modified tetracyclines. And one of these, CMT3, is the most potent of the group and is the first ever chemically modified tetracycline administered to humans. And in fact, the first studies that were done using CMT3, or chemically modified tetracycline number 3, one of the most potent of these collagen-destructive enzymes, or inhibitors, was in a type of cancer called Kaposi sarcoma. And these studies were carried out by a colleague of Dr. Ryan and myself, Dr. Bruce DeZubi at Harvard Medical School, who used the medication developed in our dental research, constructing pills, and these patients with Kaposi sarcoma, a type of cancer, swallow one of these pills per day. And these patients develop, as you can see here, these horrific angiogenic lesions. These are excess blood vessel formation all over their body. Here you see the nose and the cheek. Here you see angiogenic lesions or excessive blood vessel formation all over the skin. Here you see in the mouth, in the oral cavity, the oral mucosa, and angiogenic lesions in the internal organs such as kidney, lung, liver, esophagus, etc. And when Dr. DeZubi administered 1 pill per day to these patients, there was a significant reduction in the numbers and size of these angiogenic lesions, and in some cases, complete disappearance of these angiogenic lesions, which he confirmed by skin biopsy. Now, the same chemically modified tetracycline developed for dental disease is also showing evidence of efficacy in a very serious disease of lungs called ARDS, acute respiratory distress syndrome. And in humans, that's 40% fatal disease. And there's no FDA-approved drug for that. Now, in much lower doses of the same drug, Dr. Ryan and I are administering this. She's administering it. I just make notes. To patients with inflammatory periodontal disease, which, as many of you know, is the most common chronic inflammatory disease known to mankind. That is the major cause of tooth loss in the adult population. Dr. Kleinberg was talking about caries, the major disease in children. Inflammatory periodontal disease, the major chronic inflammatory disease in adults. And we're already seeing some preliminary evidence that low-dose CMT3 may be effective in that disease as well. And Collagenics Pharmaceuticals, a spin-off of Johnson & Johnson, which has licensed 31 patents of ours from the Research Foundation, has been testing this low-dose CMT3, which they call encyclinide, in patients with inflammatory skin disease, acne and rosacea. Now, the second therapeutic strategy that we developed was to take a traditional tetracycline drug called doxycycline and deliberately reduce the amount of medication per pill in a progressive way until we achieved such a low level of the drug that when the patients swallowed the pill, the level of the drug in their bloodstream was so low, deliberately, it no longer acted as an antibiotic and therefore did not induce antibiotic side effects, but still retained its ability to block these collagen-destructive enzymes anywhere in the body. And as a result, again, the Collagenix licensed this technology, and it is now called Periostat, and has been for 10 years. And this is the first ever systemically administered drug administered to patients with chronic inflammatory periodontal diseases. It was approved by the FDA back in 1998, but it's also the first ever FDA-approved collagenase inhibitor drug approved by the government for any disease. The disease, of course, is inflammatory periodontal disease. But Periostat is now, this dental medication, is now showing evidence of efficacy in patients with a number of medical diseases as well, including inflammatory skin disease, acne and rosacea, including blistering lesions in the mouth, pemphigoid, including rheumatoid arthritis, when this dental medication Periostat is administered in combination with a traditional anti-inflammatory, anti-arthritic drug, methotrexate, and the two, Periostat and methotrexate, are synergistic in the patient. And very recent studies indicate that this dental medication may be beneficial in postmenopausal women with bone loss. We're now publishing that data. And here we have another very, very serious lung disease, virtually no treatment whatsoever. Just published in the New England Journal of Medicine by Dr. Judah Folkman, who I'm sure you all have heard of. And using this dental medication in patients with this fatal lung disease, where they get too much of the collagen-destructive enzyme activity in their lungs, it irreversibly damages the lungs. This patient, as a result of the therapy, was taken off the list for a lung transplant because that was her only hope of survival. But as a result of that, she's leading a normal life. And finally, with Dr. David Brown, who's chief of cardiology here at Stony Brook Medical School, he and I did a study using our dental medication in his patients with severe cardiovascular disease, acute coronary syndromes. It's already published in the American Heart Association journals, and it shows that this dental medication administered for 6 months to his patients with acute coronary syndromes dramatically and significantly reduced diagnostic markers which reflect the severity of cardiovascular disease, indicate a reduced likelihood of heart attack in the future. Now, Collagenix Pharmaceuticals has now developed recently what I lovingly call Son of Periostat, which is once a day swallow a pill of Periostat instead of twice a day, and that improves patient compliance. And this is our second FDA-approved drug for the treatment of inflammatory skin disease in adults, naturally called rosacea. Why they would name it O-ratio, I have the foggiest idea. But I don't have very much say with Collagenix and their business dealings. In summary, because I've had 5 minutes to talk about 25 years of research, this is the headline in Newsday back in 1998, FDA approves gum disease pill, big breakthrough for Stony Brook, referring to Periostat. But this article was published not in Newsday, but in Newsweek a year earlier, and makes a point that we're all increasingly familiar with, which Dr. Ryan will address in more detail, namely that this most common of all chronic inflammatory diseases, periodontal disease or gum disease, is not only bad for the teeth, it's the major cause of tooth loss in the adult population worldwide, it's also increasingly being recognized as an important risk for a number of important medical disorders as well, including coronary artery disease, stroke, bacterial pneumonia, low birth weight babies, less manageable diabetes. I don't know if I can talk any faster. And recent studies have indicated increased risk for pancreatic cancer and cancer of the tongue. And so the drugs that were developed as a result of dental research, Periostat, Son of Periostat, and CMT3, which I call the more potent even granddaughter of Periostat, not only is good for the oral cavity, but is very likely going to affect the ability of this inflammatory disease to impact many, many medical diseases as well. Thank you very much. 6.5 minutes.
Larry?
Larry, have you looked at the impact of the collagenase inhibitors in osteoarthritis?
That was done by colleagues of ours at University of Indiana Medical School, Department of Rheumatology. They published double-blind placebo-controlled studies
supported by the NIH, showing that doxycycline, because of its collagenase inhibitory properties, is statistically and clinically significant in reducing severity of osteoarthritis. Double-blind, placebo-controlled studies, 2 years duration. That's Dr. Kenneth Bratt. So this whole discovery has created a whole new industry.
Okay, I too have 5 minutes to get us back on track, I promise, George. And I'll be talking a little bit about how we're going to be incorporating all the things we're hearing about here into clinical practice. Because as Dr. Kleinberg mentioned earlier, technology transfer is easier for us sometimes than the knowledge transfer, and I have certainly spent a lot of time on that. And Dr. Strongwater would be happy to hear that this is up on your 12th floor of your hospital in our General Clinical Research Center, where we have dental chairs so we can work with our medical colleagues very closely. For those of you who have not made it over to the dental school, this is our dental school. We are very proud of it. It is the 3rd smallest dental school in the country behind Harvard and Mississippi. And even though we may be small, we consider ourselves to be mighty. And we're very fortunate that we have some members of the council who are closely connected to us. Dr. Nasty's twin sister is Rick Nasty's twin sister. Ann Nasty is on our faculty, a very talented Ann and beautiful. And also Jean Garant, her husband Phil Garant, was the dean of the dental school for 13 years. He was my dean when I was a student here. At the dental school, and as Dr. Kenny has sent me up to Albany to talk to the state legislature about our dental school, I always say we may be small, but we are mighty. And you've heard a lot about that today in our technology transfer, taking things from preclinical to clinical. And Dr. Kleinberg and Dr. Golub have talked a lot about the therapeutics and diagnostics that we've developed. But my job is to take it into the clinic. And the clinical research at the dental school has expanded way beyond what you would consider for dentistry, perio, caries, halitosis. But we've also begun to focus on very high-risk groups of people, smokers, people with diabetes, cardiovascular disease, osteoporosis, and we've done studies for drug companies developing drugs for arthritis, using periodontitis as a model for the development of those drugs, because these chronic inflammatory diseases have a lot in common. Oops, can I go back one? Maybe not, forget about it. The last slide was on the General Clinical Research Center, and we are one of 77 funded in the nation, and that will be converted hopefully soon into a CTSA, a Clinical Translational Science Award, and those connections between Stony Brook, Brookhaven, and Cold Spring Harbor are very important to our CTSA. One of the challenges that we face in dentistry, and the director of the National Institute for Dental and Craniofacial Research, who presented here a couple of months ago, talked about this, is that we spend an awful lot of time as dentists convincing physicians and lay people that without good oral health, you are not healthy. And the Surgeon General, a number of years ago in the year 2000, David Satcher, wrote the first ever report on oral health in America, and it really opened the eyes of our medical colleagues and of the population in general about the importance of oral health to your overall health. One of the jobs that they have at the NIH is really changing oral health care from a prevention surgical model to one of prevention and biotherapeutics. And we here at Stony Brook really are the leaders at that. We're trying to move away from having to cut all the time and having to do drill and fill all the time, and moving into the use of drugs and medications so that it can be less invasive. In trying to teach the public about this, we have created journals. This is a journal called Grand Rounds in Oral Systemic Medicine. Dr. Golub and I sit on the editorial board. Dr. Lenora McLean sits on this board. People from the medical school are also on the board. And we are trying to educate all healthcare providers about the importance of oral health. And each one of these issues has been dedicated to different systemic conditions where oral health certainly has an impact. In addition, we've been invited to come and talk at the Centers of Disease Control to talk about how dentists can help with the epidemic of diabetes in this country, helping to identify patients and helping to manage the diabetic patient. In addition, we have worked with the American Dental Diabetes Association. Last year I presented at their annual meeting about the role of the dentist in helping to manage the diabetic patient. And for this year, the first time ever, we have the two ADAs coming together. It's very exciting. The American Dental Association and the American Diabetes Association having full-day sessions on oral care. And I'm privileged to be presenting at each of those annual meetings upcoming this year. Certainly our patients are reading about this. This was on the cover of the USA Today Life section 10 years ago. Microbes that bite, bacteria that can be couriers of disease, and how these bacteria have an impact on the entire body. They are doing their damage, increasing the risk for stroke, heart disease, diabetes, and adverse pregnancy outcomes. And that chronic tooth infections can kill more than a smile. And there have been acts that have come to Congress, the SHIP Act, to try and improve on dental health in this country, because we have had young children die from not having their dental care, dental needs taken care of. So it is very important that we expand dental coverage in this country. How does this happen? The bacteria that accumulate around the teeth get into the bloodstream if you do not treat periodontal disease. And they will attract platelets, increasing your risk for heart disease. And these bacteria have actually even been found in the plaques in people who have atherosclerosis, helping to drive that disease, cardiovascular disease. In addition, we recognize that in women who are pregnant, untreated dental disease can lead to adverse pregnancy outcomes. And we here at Stony Brook have played a role in developing these practice guidelines. And we're very proud to say that in New York State, we are the first state ever to begin to, the Department of Health of New York State is the first ever in any of the states to develop these type of practice guidelines, telling physicians and dentists how to best manage our patients and considering the dental needs of our patients. And they have told us that dental care is safe and effective during pregnancy, and have even taken it to the level to say that a delay in necessary treatment could result in significant risk to the mother and indirectly to the fetus. And there have been faculty members from Stony Brook who were involved in the development of these practice guidelines. So we're taking the dental needs of our patients and taking it to another level. It's very important to their overall health care. And most importantly, this is true in the diabetic patient. As we know, diabetes is an epidemic in this country, and periodontal disease plays a major role in this disease. And this is a patient that was referred to me from our hospital. And this is a patient who has type 2 diabetes, has cardiovascular disease, has significant complications of her diabetes, and yet they could not get her under control. Her A1C levels were very high. And so when she came to see me, you can recognize that the caries and the periodontal disease that this patient is suffering from certainly could have an impact on her overall health. One of the problems that we have is the dental coverage for these patients is not where it needs to be, and that needs to be addressed, and we're working very hard to try and improve on that. And this is just an example, and you don't have to know all the numbers, of a patient who we treated with periodontal therapy at the school, and you also using the medications that Dr. Golub is talking about, Periostat, in combination with that. And we were able to bring her A1Cs down, that's her level of diabetic control, and also her CRP levels, which are markers of her risk for cardiovascular disease, went from high risk to low risk just by providing this medication and giving the periodontal therapy, in addition to all of the medical therapy that has been provided to her. So we're assisting the physicians in managing the patient. And also we had improvements in markers of kidney dysfunction, such as proteinuria, microalbuminuria. And one of the interesting things is when you look at the oral cavity, it certainly reflects what goes on in the rest of the body. And when we look at the markers of inflammation, which are high in the urine and the blood of this patient and in the mouth, they go down in all areas. So the Surgeon General a number of years ago said that the mouth certainly can be an indicator of what goes on in the rest of the body. And the fluids that we have coming out of the pockets are serum transudates. So they do give us a lot of information about the systemic health of the patient. Your blood glucose levels looking in the oral cavity of a patient. It's very interesting. Oops, am I pushing the wrong button? So if you look at the old spittoon, I remember my grandfather used to talk about the spittoon. Future directions are in salivary diagnostics. We believe that we can develop home test kits for people to determine if they have periodontal disease at home. A lot of people don't know they have this disease. It's estimated that 65 million Americans have some form of periodontal disease, yet it's often a silent disease. So we'd like to develop some sort of home test kits. We're developing diagnostics for centralized laboratories, and also we believe that physicians can use these types of tests to determine if their patients require dental care and refer them out to us. And we've had several meetings with our medical colleagues to determine how to move forward in that direction. And if you don't think that the insurance carriers are interested in this, they certainly are. This was published in the Wall Street Journal. Health plans expand dental benefits. Studies linking gum disease to health problems spur new focus on preventive treatments. And because we are a model here at Stony Brook, and because we have such innovative programs, I've had the good fortune at presenting at almost all of these dental insurance carriers, their board meetings, and they're interested in looking at us as a school where they can create a model for new programs. So we look forward to working with them on that. So last slide, the need for an institute. We believe we've gotten to the point where we need to consolidate our efforts and move forward, and for the continued development of our translational oral biology research, for the implementation and integration of new diagnostic and therapeutic technologies into special clinics. People travel from all over the world to ask us for our help, and I think we can move this forward by creating an institute. For the continued education of a new generation of healthcare providers, to foster entrepreneurship and commercialization of novel technologies such as those you've heard of today, to harness the current regional initiatives to foster the continued development of a world-class dental research and development facility, and to work towards the creation of guidelines for the dental professions, and perhaps even for the medical profession as well, and to implement new and innovative educational programs for healthcare providers crossing many disciplines, and to serve as a local, national, and international resource. So thank you for your attention, and we're all here for questions.
Are there any such institutes in the country now? Are there any?
No. And actually, Dr. Kleinberg would like to name it TOBI, which is the Translational Oral Biology Institute, and we would be the first.
I told Dr. Kay that last slide was for her. She's in.
I
I don't want to speak for her.
Yes, Dr. Benedict.
Yeah, I think, it's a great presentation.
Thank you.
As an OBGYN, I'm a culprit myself because in private practice, we never mention about dentistry to patients.
Yes.
And now, having been a member in the committees, now I'm pushing that all those community clinics should have a dentist physically present.
Actually, I believe that's true, and actually Dr. Strongwater and I are hoping to work towards developing those types of programs in the hospital where there's better integration with the clinics, because many of these patients will not make it over to the dental school, so we need to make it easier for them. And in some of the studies that we have done in the GCRC, I have women who come in who said they've had early delivery 2-3 times, and we look in their oral cavity and they look like that woman, the diabetic patient. And I say, what happened? And they say, either no one told me that it had any relation, etc. So certainly, yes, it is something that we should facilitate for people and make it easier for them.
John.
This might be for Dr. Kenny, I'm not sure. I know the university has significant patent revenue. Does the university have discretion on how to spend those money so the dental school develops a product that's going to produce, significant, or I know they already do, but greater
That was a plan. Who planted that question?
I know exactly your plan. He's sitting over there with white hair.
Do you want to answer?
Actually, President Kenny did a marvelous job at the question. In that she has, I'm sorry.
She has done just that. And one of out of the first large royalty payment from the Cavestat, etc., which was, can I tell them the amount?
Sure.
Okay. which was $8.3 million. Okay. And she steered $1 million of that for some of the things that I put on there for continuing. And we've had some chats about feeding back into, and this generally, feeding it back into the this translational enterprise in the university, and put the money into that and grow it. And I think that one of the things that we happen to have the advantage of is that we're close to so many different applications, and if everything goes well, we should have plenty of it. Let's hope. Okay.
There are two issues. We have a formula of how that money is distributed. Some goes back to the PI, some goes to me, some et cetera, et cetera. And that's what he's talking about of mine, out of the piece that does not go back to the there's the other issue, and it's one that I worry about all the time, because I think we've done a good job, as you know. Maybe you don't know, for the last, if you look at the last 10 years, 95% of the royalty income for all 64 campuses, 95% has been at Stony Brook. Now, that is mostly because of a single drug, Riapro, which I think you all know about. And now we have the second big drug coming in. But the other piece I worry about is our having the best possible legal advice to get the best possible deals as these new products come online, because that's a very, very sophisticated area, and we do work with a law firm in Washington that knows a lot about royalties and patents and so forth. But you know, that piece, we've got to make sure A, that we get the best possible deal when we go with the company, and then B, how do we distribute the money to increase, and all of the royalty money has to go back to research.
All
All of it.
Is there any way that the state could tap in? Let's say, I mean, we've already hit it big, but you hit it big again. You know, is it guaranteed to always stay at Stony Brook?
I worry about that because, in fact, it's not the state, it's the Research Foundation, which is a separate 501c3, the SUNY 501c3, and the royalty money was never taxed in the past by RF, but now there have been some, it shouldn't be taxed. It should all go back into support of research. But there is this division where a large portion goes back to the PI and work done there, and the department itself, and then some comes to either the provost level or the dean of medicine level or whatever, and then something. But the whole deal is getting a really good deal when you're making your agreement with the company.
Well,
I mean, you hear the numbers here of what the sales are going to be. It's
tremendous. Well, I would be concerned about becoming a victim of your own success. So you also, when you crank up this patent revenue, and the state looks at your budget and says, you know what, Stony Brook, you don't need these state dollars. You know, we help you build these facilities and so on and so forth. And you know, there's needs elsewhere.
Yes.
Any more questions? Mayor, do you have a question?
Yes, I did, and you sort of triggered another question. So these patents were not federally funded. As you're talking about being a member of the AAU, most of it is because you get research from federal government.
Now, I don't know how much federal funding you all have.
Dr. Gall.
We do have federal, yes.
It isn't the same in all cases. It varies considerably. For example, and I'll speak from one's own particular case, I've gotten roughly about 50 years of continuous funding. Okay? And everything was fine until I came along and said, you know what? There's one microorganism that they're all focusing on, strep mutans. It's impossible for it to be the cause of caries. And what I was saying was that here's this mixed bacteria, this mixed population is actually simpler to study than a single pure culture. And they were ready to take me off to the booby hat. I then had to go to industrial funding. And that has been marvelous. I've gotten, because I've been dealing with them for almost 50 years, and I've had superb grants, which we call platinum grants, where here's the money, give us the stuff in this area, do what you want with it. Now,
From the federal government?
No, from
that's
industry.
from
Oh, from
industry.
industry.
Industry is,
Yes.
they're ready to work with you.
Yeah.
And as far as just to respond briefly to your comment, President Kenny, is that we've got excellent deals with Vortec and so forth. And that fact, we have coverage in a lot of countries. And
I was not speaking of you, I was speaking in general.
No, I'm speaking, no, but I was going to lead on from that, is that it depends on how you go about working with the negotiations. It so happens, the way we worked with it, the ones that's Vortec in particular, the intermediary was investment bankers who did the negotiating for us, the best on Wall Street. And they're the best. And they, because Mitch Goldberg was the president of companies, had experience in this. And they did the negotiating. We didn't have to be the bad guys. And as a consequence, it was a nice big chunk upfront money. And of the royalties, Vortec, which is the small company, gets half. The university gets half, split down the middle. There is, as Dr. Gallo mentioned, with regard to patents and so forth, between the two of us, there must be about 90 patents and so forth. I don't think the university had to pay 1 penny.
So who owns the patent? Is it the company, or are you partners? And are you part
No,
of the
the
partnership?
university. The university owns the patents.
Oh, the university?
Yes, and when we were involved, and perhaps a little more than Dr. Gallo had, that's something I made sure of.
Mhm.
The university has the patents. And besides royalties, the university has stock in the company. So even when the royalties run out, if the stock is still there and the stock grows and expands, you know, when you take something that's a startup company, it becomes very large and so forth, then you benefit.
Yes.
So supposing a fair number of those things come to fruition, it means that the stock in Vortec, the value goes up.
So when you were talking those numbers, sorry, I only know you as Izzy, so
Okay,
I'm
that's
sorry
all
about
right.
that. But when you were talking those very large numbers, is that a prediction in the future? Is that happening now?
No, what is happening, what I gave you was the numbers of the market sizes.
Sizes.
Now, what's happening, take for
Potential.
example on the mints. I'm going to be quite specific here. The mints, now that the publication is going to come out, it's either going to be the end of this month or shortly thereafter. What will then happen is there will be publicity. There will be publicity associated with it. At the same time, what is happening is that since we've done all the studies that you need in order to in order to get the FDA approval, final approval, what happens here is because we've done all that and so forth, we only have to do certain steps with a GMP made material because we thought we would go food. It's going forward as a drug. We will reach a point roughly maybe by September. And then this is where you have your professional firm go ahead and do the negotiating as to who to sublicense it. So the numbers can be anywhere.
So the
But Izzy
8.3.
mentioned a very important thing, which is getting equity in the country, in the
Yeah.
company. And that's one of the
Yes.
things that we're looking at.
I see.
What
Yes.
we can do, because it could make a big, again, I'm not talking about their products,
Sure.
I'm talking about in general.
In
as we
general,
look to
yeah.
a
That's
tech
very
transfer.
interesting.
It could
It's
make a
a-
big difference.
It's actually, there's a lot of sort of, universities are sort of learning now. Fortunately, we're about 20 years ahead of the curve when it comes to this. It's one thing about getting the patents and so forth and what have you, but it's what's beyond that.
Right.
It's beyond that. And in negotiating these deals and who's involved in it and so forth and what have you, that's It's extremely important.
So it's all on the,
In
it's got
fact-
great potential, I'd say, for revenue. I'm a bottom line person, I'm sorry. I heard those numbers, I was very excited and was hoping it was all going to the
Well, I know
dental school
that people
naturally.
think I smoke pot when I say this. But what I was going to say is this, is that it's a new model. It's a new model. Whoever succeeds in this, really succeeds in this, will make Harvard's endowment money look like a piker.
Yes,
That's-
exactly, yes.
I know we dream high and so forth, but I think we
Dr.
get
Gallo.
there. All I need is another lifetime.
Well, Larry, you
Doctor.
wanted to say something?
I'm always given 5 minutes in these presentations.
I'm getting used to it. Are my 5 minutes up, I think? Another track, the track that I largely pursued myself, which is a little bit different than the one that Dr. Kleinberg pursued, was my 35 years of funding largely came from the NIH, from federal sources. Having said that, no difference, in the sense that all the patents we generated, I think 31 US patents, it was all with NIH money, but all the patents are assigned to the Research Foundation of Stony Brook. The university owns all the patents. Government makes no claim on it whatsoever. As far as royalties and all, so again, these patents are assigned, the Research Foundation licenses them out. As far as Periostat, and by the way, that patent expired. It's a 17-year patent, like every patent, expired in 2004, because the patent was issued in 1987. Now you have son of Periostat, which is Oratia, which is now producing revenues, and it's a prescription drug by dermatologists, but coming out of dental research at the rate, the first year of sales was $50 million. And I think Stony Brook's agreement is 1.5% because it has mixtures of different ingredients in it. Periostat generated at the beginning, and most dentists were not familiar with Periostat. It's a totally new concept. It reached at its peak in about 2003 $50 million per year, and generated totally about $10 million of sales. The problem is defending the patents, and that costed a lot of money. As far as additional revenues, 44,000 shares of Collagenics are owned by this university. And the current stock price of Collagenics went up to $16 a share because a Swiss dermatology company, Galderma, which is a spin-off of L'Oreal and Nestle's. I don't know much about this stuff. They founded Galderma in 1981. They're in the billions of dollars of products, and they now own Collagenics. So what started off as a dental company is now a Swiss company as of weeks ago, and I think they acquired Collagenics for just under $500 million. So a little dental product which started, Collagenics has had interest. It was a learning curve, as Dr. Kleinberg said, and in the 1980s, I'm not sure I knew what I was doing other than basic science research and trying to develop new medicines. But now with Oratia, you do have a product that could reach $100 million a year within a couple of years.
My goodness.
Actually, the greatest opportunities are to be using, in my opinion, as somewhat of a novice, is to combine that with aspirin for the prevention of heart disease.
We have 2 patents on it.
Right, and that, the impact, and I'll comment again, osteoarthritis is one of the most common and prevalent disorders in the United States.
Right.
Rheumatologists will not give chronic antibiotic therapy for osteoarthritis
Right.
because of the secondary complications, but if you're able to achieve what you've achieved with Oratia or with Periostat, rheumatologists would give that.
Yes.
And many of their patients have problems with dry mouth. You already know this, and it would help with that secondary problem. So it could really be very exciting.
It's a learning curve for both professions. I mean, I know, as Dr. Ryan spoke about a great deal, it was like pulling teeth to get the dentists to write prescriptions, a systemic medication for a dental disorder. They don't like that. It's beginning to happen, but it took us a decade to, as Maria mentioned, it's information transfer or teaching them how to use it, not just developing the tools.
Congratulations.
Thank you, this is
Okay,
exciting.
thank you, this was great, thank you. We talk a lot about the great research going on, and every time you hear one of these presentations, you get more excited, and certainly from the dental school, it's just terrific stuff. It's very exciting. And Dr. Kleinberg and Gollop, I know you fellows are busy. You don't have to stay for this For the rest of us, you guys gotta go, just go, please. Dr. Ryan has to stay. We're not letting her go, but you two.
She's always more popular than
Well, listen, if I had any more comments about my my beautiful sister, and you know, we're twins, you know, I got some, right?
There's one thing that we, Dr. Ryan had hoped to have for you were samples, you see, of the toothpaste and so forth, for the Colgate label. But unfortunately, they didn't send the right stuff. However, I do have some of the mints here.
Oh, cool, great.
And it's one of these blister type of things, and if you each take yourself one, and if you want me to take one to prove that it's safe and so forth. And,
George, why don't you-
and essentially, if you take 4 of these, I guess, let's see. Yeah, why don't you send this?
It's never enough.
John and I want to be there. John and I want to be in the beginning. We're in.
I told you it would be a pain.
Is that the candy?
I guess these are the mints. These are the mints. If anyone wants to get coffee or something like that now, it's probably a good time to do what you got to do. But
Is it you take 1 or 2?
This is the candy?
I guess you.
What do you do with candy?
Oh, I'm sorry. All you do is you just put it in your mouth like you have an ordinary mint, and then when it's nicely dissolved, you can either finish it that way, but just to give you an idea of the taste, but the way it's done and the way the children did it, they then crunch it into the teeth and they have
You do a
it.
Tootsie Roll. Tootsie Roll. You know you get to the
And incidentally, we made chocolate-coated ones. We didn't have very many, but Dr. Kenny, she did have. So, thank you.
Pretty tasty. For science.
Not bad for medication.
You want to hear something funny? That was my wife that just called. She's watching online, and she wants to know if the mints have NutraSweet, because you can't have NutraSweet. Just show you, right? That is cool. One of the byproducts of being such a great hit, and all the applications we're getting, and I think we have record applications again for the September class, is the challenge of housing. And Dallas Bauman, who does such a great job at trying to manage that challenge, probably stays up late at night trying to figure out how to de-triple students or get students into
Careful
better
now, you
housing.
can steal all my material, Rick.
So anyway, with that, we haven't done this in a long time, and it's such an important part of the university to provide decent housing for the students. And you can see the construction going on behind us. When I attended the university, certainly this was never here. This housing, West Campus is, and Reed as well. So we look forward to hearing from Dallas about what the plans are, what the future is, and then to segue with Carol, just to hear a little bit about, and I bring this up a lot, about private sector and what their role can be, should be, and whatnot. So Dallas, you're on.
Thank you. I'm delighted to welcome you all to West Apartments. I want to point out that after your materials were printed, it was suggested that I should get some red into the presentation. So I didn't hold back on red. It's a pleasure to talk about where we are with respect to housing at Stony Brook, student housing at Stony Brook.
My frame of reference is that I arrived here 26 years ago next week, and to say that things are dramatically different from what they were when I arrived would be an understatement, to say the least. We really are very proud of where we are as a university with respect to accommodating students on campus. We've grown, we've expanded. We could say we are victims of our own success because our demand far outpaces our capacity at present. And again, as a frame of reference, in the early 90s, we had 800 empty beds at one point in time. This year, we started a very busy academic year with more than 800 students tripled. That means 3 students assigned to a room that's designed to accommodate 2 students. I'll talk a little bit about tripling again in a moment. But we managed that capacity. It's a good thing we did, because we're going to be facing similar circumstances for the next couple of fall semesters until one of our construction projects is completed and gets us closer to where we need to be in order to accommodate the demand that we face or we experience from students. I'm going to talk about some indications of success in a couple minutes, but really where we are with respect to current demand is a consequence of freshmen, transfers, and continuing students all applying to live on campus in greater proportion than has ever been the case. It's continuing to increase, which I take as an indication of how successful we are in providing accommodations that students like, that they value. This past fall, we managed some of the demand in excess of capacity by telling about 110 new transfer students that we wanted them to come to Stony Brook, but we would not be able to offer them housing in the fall semester. We guaranteed them housing for the spring semester. As far as I know, all 110 of those students enrolled. 64 of them indicated that they would want to take advantage of housing for the spring semester, and only 37 actually did. Which is an indication of how important it is to students to be at Stony Brook, to our students to be here. And though housing is of interest to many, it was a successful strategy in terms of managing that demand. We started this spring semester with students still in triples, which is a first for us. And though there were about 200 of those tripled rooms at the start of the semester, I should tell you that right now there are still 113 tripled rooms, but not because we are over capacity. That's 113 tripled rooms where students declined the opportunity to move to a regular assignment. So it's a testament to, as undesirable as it might be perceived to be assigned to a triple, nevertheless, when students get here and establish relationships with the other 2 residents in the room, they don't want to leave. And that occurs all year long, but 113 tripled rooms that are voluntary triples is a testament to that phenomenon. So not something we should plan for, but it's certainly an indication that as a strategy it is viable. Our planning with respect to the future is indeed data-driven. We've done a lot of analysis of enrollment projections, trends, and those changes in demand. And it leads to what our plans are for future years, and I will talk about those, but they are indeed consistent with the 5-year plan, and in particular, the intention to grow to 25,000 students here. Much of that, in terms of at the undergraduate level, we'll probably be able to achieve through improvements in retention, even if we maintain stable incoming numbers for freshmen and transfers. But it does suggest that we're going to continue to face increased demand for housing on campus. So at present, where there's a building under construction, which is that way, everyone's orientation gets shifted when you, this is not a typical grid plan here, and some people get lost finding their way here. The building adjacent here, which is part of the West Apartments complex, will be completed at approximately around the end of the spring semester. We won't actually utilize it until fall. And I should say that the West Apartments here, which the first group of 4 buildings, which are the ones you see out the windows here, opened in the fall of 2001, 528 beds. The second 4 buildings, this building and the 3 adjacent to it, opened in the fall of 2004, 678 beds. If that totals 1207, I got those numbers right. The next building, another 173 beds. So we have about close to 1,500 beds here. These apartments are available only to upper division undergraduates, junior or senior standing, who have at least a 3.0 GPA and who have previously lived on campus. And we maintain a waiting list for these spaces throughout. They're predominantly single occupancy in an apartment of 4, 5, or 6 bedrooms, full kitchen, 2 full baths, living and dining area. And so I don't neglect to mention this later. When we're done, if you'd like to see the facilities here, the fitness center and computing center, which are just across the lobby, we have facilities of that type in all of the quads, and we also have an apartment currently occupied that we could show you if you'd like to see that. So these are very popular facilities and are sort of our crown jewel. In addition to the building that's under construction now, we have in design, about to go out to bid, foundations about to start being installed for a 600-bed project that will add capacity to the 2 adjacent quads here, Kelly and Roosevelt. That is scheduled to open in the fall of '09. Given some really good luck and some breaks, it might be by the start of the fall semester, but indications are it will be sometime during the fall semester, so that's why I'm suggesting that both this coming fall and the following fall we're going to face a significant number of triples. We are also waiting for the Office of the State Controller to approve a contract for Sasaki Partners to do an analysis of sites on the campus where we could add additional housing for subsequent years, because the 600 beds won't get us to where we think we need to be in terms of meeting demand from students. It's likely that if we add 400 beds in the fall of 2010 and another 400 in the fall of 2011, we will then at that point be at a place where we can suspend the 8-semester rule. We only permit undergraduates to live on campus for a maximum of 8 semesters, 6 semesters if they come in as a transfer. We have a waiting list that is typically 500 to 600 students, most of them continuing students that we never get to. So 600 beds won't close the gap between where we would like to be in terms of being able to offer the opportunity for anyone who wants to live on campus to be able to live on campus. So this Sasaki study will look at systems on the campus, utilities, roadways, parking, and where we have space where we can add capacity. And we hope that within about 8 months or so we'll have a set of recommendations from that group that will lead us to the direction for additional capacity. We also are about to engage with Brailsford and Dunleavy to do a business plan for additional graduate and professional housing. The Graduate and Professional Housing Task Force, chaired by Charles Tabor, the chair of the Graduate Council, has done a survey through our Center for Survey Research, come up with an analysis that suggests that in addition to the Chapin apartments, which are affordable and very popular with a significant group of our undergraduate students, the Schaumburg apartments, which are just across from the West apartments here, is sort of our mid-range, and the Graduate Task Force is recommending that we add additional capacity for populations of graduate students, primarily those who are married graduate students living on campus currently, and our medical residents and medical students who are not living on campus at all, that there is clear indication that they would be interested in paying the kinds of rates that would be necessary to charge in order to support new construction. And so Brailsford and Dunleavy will take the results of that initial study and develop a full business plan for us and suggest to us how many apartments of what type and at what rents we should be planning to add. We have been very much focused on maintaining quality in our facilities. We completed one of the I think probably the most extensive renovation of campus housing in this American higher education. We spent $80 million renovating all 6,300 beds in the 26 residence halls, 1.5 million square feet, and we did it in 10 years. were just beginning that when Dr. Kenny arrived. The first time I think I got to introduce Dr. Kenny was at the ribbon cutting of the completion of Rothquad. If I remember correctly, that was the fall of '94. We completed that by January of 2001 and started over again. So not only did we invest a tremendous amount of money in improving the quality of facilities, which in large part accounts for why living on campus is such a popular option for our students, but we began a 10-year cycle, and I'm confident that there's no other campus in the system, in the SUNY system, that is renovating their residence halls routinely every 10 years. There may be some other campus somewhere in the country. I don't know of others, but it is a significant contribution to our success. And we have taken the lead on a new initiative, an agreement between SUNY and the Dormitory Authority to permit campuses to borrow funds through the Dormitory Authority but locally manage the project. It's called Campus Let. And don't get me started on working with the Dormitory Authority in project management. But this will give us the opportunity to manage projects locally, but take advantage of one of the things that the Dormitory Authority does very well, which is sell bonds at very favorable rates. So there are 3 buildings at Southampton that are under renovation as we speak. Through this Campus Let, as it's called, agreement, we will be renovating Tabor Quad this summer through Campus Let, and we're eminent to request construction, the first Campus Let construction project, which would be a facility at Southampton as well. So we are taking the lead, and believe me, the rest of the campuses, as much as they envy us, they certainly do on this, and they want us to open the barn door so that others can follow.
That saves both time and money.
Absolutely.
Significant time, significant money.
Absolutely. You can add about 50% to the timeline and 50% to the cost of DASNY managed projects.
In scope, what will a renovation include?
Well, the first round was some significant systems work along with the aesthetics, new carpet, new furnishings, window coverings, painting throughout, whatever. Currently, the second round is fortunately not quite as costly. We spent between $10 and $12 million per quad for 1,000 beds in the first round. The second round, it's between $6 and $7 million. So it's mostly about the aesthetics in this, it's a refurbishment. We did not, in either the first round of renovations or in the subsequent, reconfigure facilities, which gets to be very costly. Actually, the first 3 buildings at Southampton, the 6 existing residence halls, the 3 that are done, 3 that are in process, they actually required significant reconfiguration of the space, taking down walls, moving things around, putting in new bathrooms. That's far more costly than what we were doing. But we were doing basically guts of the mechanical rooms in each of the buildings on that first round, and there's not much of that is required at this point 10 years later, because we did a pretty good job with it the first time.
Insofar as computerization is concerned, what is the configuration on that? To what extent? Or
we've got, as I mentioned, there's computing centers in each quad, and in spite of the fact that we've got great accessibility, access to technology in the bedroom, 1 port per person, we're upgrading that as we go along on this most recent round of renovations in terms of the speed, but we've got good capability in every bedroom. And in spite of that, students still take significant advantage of facilities like this computing center because they can work in groups there. They have access to some software that they might not own personally that we provide on campus networks and whatever. So
the reason I asked that question is because of the safety factor we've done with the shootings on the campus or whatever. Is it possible that we're being able to get through to every student?
Yeah, there are a variety of systems for doing that. Safety is the last slide in my sequence here, so I will come back to that.
You got any wireless, Dallas? Any wireless?
And mostly in public spaces. The configuration of the facilities do not lend themselves easily to, fortunately we have lots of small residence halls. I've worked on campuses with 25-story high-rise buildings, and I would not build those kinds of facilities if I had the option, and we have not built those kind of facilities here. So because we have a very complex physical plant. It does not lend itself easily to a lot of wireless, but this room, spaces like this, we're typically installing wireless capabilities. So I was about to say, we're very much concerned about getting measures of student satisfaction. I think the increasing demand for living on campus is an invariant indication of success. But we have engaged for the last couple of years with Educational Benchmarking, which is a national firm that has campuses across the country as clients. We use their survey methodology. And two of the indications that you'll see on these slides suggest not only are we getting good outcomes, but they are improving in this statistically significant at the 0.05 level for overall resident satisfaction, and the other measure here, overall program effectiveness. Both of these are aggregate scores from multiple items. It's significant at the 0.001 level. So residents tell us not just by their feet, but by their responses on surveys that living on campus is a desirable experience. We're also focused on keeping costs in line, which is not an easy task given how much money we're spending on renovations in and of itself. We know about the differential between operating costs here as opposed to other places in the state. So it is not at all insignificant that over the last 5 years we have gone from being the most expensive in the system, and this was just about at the end of that first round of renovations, to now being this year number 8 on the list.
What does that mean, the most, in terms of what?
This is the cost of a double room to a student, which is the base of comparison.
The price to a student.
It's the most, it's the easiest way in which to draw a comparison to rates on other campuses. There's quite a bit of variability around this rate for us and for other campuses as well, but it's the benchmark that's used. So that, again, that's very significant. I haven't seen a report on this out of SUNY recently, but years ago, when the last time that they did a comparison of staffing ratios on campuses across the system, we had the lowest staff to resident ratio. So part of that is we have a lot of very hardworking people who are very efficient and very effective in what they do. That goes across not only professional staff, but classified staff, maintenance, and custodial staff as well. Another indication of our keeping costs in line is this is the 5-year average of increases in rates across all 30 campuses in the system. And we have the lowest average increase, it's 4.1%. The opposite end of this chart, their average across 5 years was 9.4%. We're looking at probably a 5% increase in rates for next year. Most of that driven by negotiated salary increases, increase in the cost of utilities, and inflation. Some program changes, but predominantly those factors. We are concerned about this being a caring and safe environment. I would put our staff up against any staff, I say in the Northeast, but I'd probably go beyond that. I just came back from a national conference in Boston that had a placement exchange, candidates from all over the country coming to find positions. We were looking for hall directors, and we were swamped with candidates. That's a good position to be in. With 30-some hall directors, there's turnover every year, and so we are looking to recruit from among the very best, people coming out of master's programs from the very best of those programs from around the country. But whether we're talking about our 200-plus RAs, how many people in the room had histories as an RA? Guilty as charged. I think our RAs are some of the hardest working people on the campus, not just students. The RAs, the residence hall directors, the quad directors, the rest of the professional staff who deal with residents on a day-to-day basis are very hardworking, very dedicated people, and they offer support, guidance, direction, and manifest caring in one of our most significant ways. They are also central to the campus residences is central to the undergraduate college model. I assume this is something that members of the council are familiar with. And one of the ways in which we are invested in the undergraduate college model is that the 30-some hall directors teach sections of the 101 course that is required of all freshmen in the first semester, and delivering 120 of those sections every fall, that those 30 sections are an important contribution. Every hall director meets in the fall semester within the first 6 weeks with every new student in the building and has a conversation about their plans for the year and beyond the first year. As another example of how we're involved in the success of first-year students, and we know that that's critical to everything that happens beyond that point. Also, we have facilities in the 6 quads in which each of the 6 undergraduate colleges are based that support the programs and activities of the undergraduate college. I might suggest that at some future council meeting be held at the Tabler Center if you'd like to see what I think is the crown jewel of the undergraduate college facilities. We're opening imminently a facility in Mendelssohn Quad for information and technology studies. The new facility, the 600-bed project that I mentioned a few minutes ago for Kelly and Roosevelt quads, will include shared facilities for the undergraduate colleges of human development and global studies, and will be comparable to what we're able to offer in Tabler. On the topic of safety, certainly it's been an emphasis for us for a significant period of time, predating some of the recent incidents that have been cause for concern. Among the things that we think are particularly significant in enhancing the level of safety in the residence halls and apartments is, first of all, our residential safety program, which is another group of very hardworking students, about 300, who work in pairs as patrols to patrol exterior doors. They also, a crew of them are at entrances to the buildings to sign in guests during late night hours. They're quite identifiable as they walk around, unpropping exterior doors or checking to make sure the doors are locked and secured. We work very closely with university police on almost anything that comes up, and I thought maybe Rich Young and Doug Little would be here to reaffirm that, but I know they wouldn't challenge my point. We are going to be instituting security patrols. We've hired as many students, and they're working as many hours as we can through the residential safety program, and that means that we do not have the coverage we would like between 2 or 3 in the morning and 8 a.m. So we are about to contract with a security service to come in and have, they will come in, there will be a person patrolling the inner quad and checking exterior doors between midnight and 8 a.m. Every night. And that will begin sometime later this semester, as soon as we can get that contract through OSC. So you hear a theme there. And we also are, within the next 2 weeks, we'll finish the installation of electronic monitoring on every exterior door, in excess of 200 exterior doors on the residence halls and the apartments. Many of them were previously monitored, but we made the commitment this year to extend that to every exterior door, and that is in process and imminent to be completed. And there is a safety campaign that has been going on. I will pass around a sample of 3 different posters that were used. And there may be enough for each of you to put on your own door. Part of this safety campaign, a door hanger that emphasizes students' responsibility, their contribution to maintaining safety on the campus. And there are additional posters that are coming out as part of this campaign. There was an ad in the Statesman. So all of these things taken together, we think, contribute to significantly enhancing the level of safety in the residence halls and apartments. So as I said, I'm delighted to have had the opportunity to welcome you here and talk about the experience of living on campus, and would love to show you facilities if you're interested in seeing them, and if there are any questions. Yes?
On that COL 101, as a former school teacher, is roll call attendance taken at that?
It is. That is a graded course, the 101 course, which is particular to each one of the 6 undergraduate colleges. Yes, attendance
because
is.
In the interest of what might happen in safety with maybe uninvited people being in rooms and so forth, if there was a problem, student might say, well, I didn't know that rule. If we could say, yes, it was covered, you weren't there.
Well, it's covered, and we make it available through a variety of forms online, in print, and
How many
whatever.
meetings do you have of 101? Is it
The
just
101
one
is 15 hours, so it's,
Oh, I'm sorry.
most of them are once a week over the course of the fall semester. Some of them meet 2 hours for 7 weeks, but it is the equivalent of a 1-credit course. It is 1 credit. It's graded credit.
Just as a point of information, Mr. Baum, congratulations, these facilities are gorgeous.
Thank you.
And they're clean and well kept, and I was just wondering, as an example of what it costs to live in a structure like this as opposed to one of the old dorms, could you kind of give me numbers where I would feel the differentiation?
I'm glad I asked Joe Lochran, my financial person, to get those numbers and be here to share that in case that came up. Joe, you want to talk about
The
it?
question you had asked is
How much would a student pay to live in this facility as
Okay.
opposed to something that would be an older facility?
the test number that Dallas had mentioned in regard to that chart was for a double room in the res halls. The res halls are about 70% of the building, of the beds here. That rate standard double is about $2,700 a semester.
A semester?
Correct. To live here, you'll tour this. To here is about 29 and change a semester for a double, and about 34.25 for a single.
It's quite a bargain.
Yeah.
When you think, and you have to be a graduate student. Am I
No,
right?
there's upper division undergraduates here.
Upper division, I see.
So that's the range. A standard double room to a single, 2,700 to 3,400 for a single in the apartments here. And those pretty much define the ends of the continuum.
Any other, Jack?
Just, what is the, just to get an overall picture, the approximate population that's housed, the total?
We have just over 8,700 design beds, again 173 coming online, but in terms of the numbers too, we use 9,000 as a round number just in terms of getting our head around it easily. But 8,707 I think is our current design capacity. But as I mentioned, we started out with significantly more than that at the beginning of this year.
Any other questions? Dallas, thank you very much.
Thank
Doing
you.
a great job. Keep it up. Carol, if you can just Carol, if you can just give us a, it doesn't have to be long, just a quick thing, because I know that it's something we've looked at for, always looking at. And I'm always interested in knowing what role, if any, the private sector could play, what the, again, I'm in commercial real estate, I have no idea what the economics are, even if you give a developer land for free. What the economics are for building and leasing and all the rest of those things.
Well, let me just give you a very brief update. Just to give a little background, several years ago we met with new faculty that have began their career at Stony Brook, and the issues that they were having in acclimating to Long Island was not so much buying a house, but was really trying to find affordable rentals. So we've taken several actions to try to pursue that. One is that we've expressed interest with Suffolk County in the development of workforce housing. They are in the process of trying to develop a workforce housing complex in Yaphank, and the university has expressed an interest of 50 to 100 units if that ever materializes. The other area that we pursued is with TriTech. They're very interested in working with the university in developing an apartment complex in support of our faculty and staff needs. The only issue that has been causing us a little difficulty is that we're waiting to get some flexibility with the ground lease legislation. And we were hoping with the report on higher education that there would be some movement with the ground lease. It's very difficult to get a ground lease which allows a private developer to come on state property to build. And until we get some flexibility, it would be very difficult to get a private developer to come on campus to build a faculty staff apartment complex.
Has that been done in SUNY though, added at private summer?
No, in Buffalo, Buffalo has used their local foundation, Realty Corp, to build both residential and faculty staff housing off campus. But it has not happened on other university properties that I know of.
And there's no way to configure to the foundation is the nominal developer, and there's all kinds of ways to, or they see through that
well,
stuff.
if we use our local foundation to help build faculty staff housing, we still need to go through the legislation to have ground lease approval. And
Even to your own, even to the foundation.
exactly.
Right now, with the gift from Jim Simons, part of it is to build a building for the Simons Center for Geometry and Physics. We have to get a ground lease for him to give us that gift and build that building.
And the process, just to try to make it very simple, the ground lease needs not only the SUNY Board of Trustees approval, and Janice is there to help me, legislation approval, plus it has to go to the Office of the State Controller, and you can hear from Dallas's presentation how much he enjoys that process, as well as the Attorney General's office. So the process currently is extremely cumbersome, and we're still struggling with the ground lease that we're trying to get through the system for the Simons building. So I mean, I think it would be a very exciting thing to have on campus, faculty housing, because I know that there's a need for it currently.
Yeah, so there's no possibility, I'm using generic terms, I don't know that much about them, but like to have the foundation as a parent corporation and then have, you know, an offshoot of the foundation as a for-profit child that could enter into a ground lease?
No, that's exactly what we're currently doing with the Simons facility. What we're trying to do is utilize the Stony Brook Foundation to have the naming in the ground lease to allow the construction to occur through Stony Brook Foundation, managed through the foundation, and it does not have to go through the State Controller's office. But in order to do that, you need ground lease approval. That's the process. We can do it through our local foundation. We can use our Stony Brook Foundation Realty or our local foundation, but it's the ground lease that allows state property, a private developer, to come on and build on state property.
Yeah, I guess that's the conflict. The state
That's the
property is a
conflict.
complicated time.
Now, when we met with TriTech, they are looking at other areas around the university where they could potentially build, but we all know what the price of construction today is. But they will be providing us with, hopefully, a proposal within the next few months that we can take a look at.
Do they need to go through the Wicks law process as well if they're not a profit? Yes. And what process do we use to put up the Wang Center?
We did the ground lease legislation.
did.
Yes, we did.
Was it difficult to put that together?
I wasn't part of the process by then, but it has to go through the same process that I just described. Janice, can you speak to that?
I'll be honest with you, I don't remember when, it went pretty smoothly when we did the ground lease for Wong. That was the model that we're using. I spoke to Senator Flanagan's office yesterday. They have drafted the legislation, and they're prepared to move it quickly through the legislature, so.
There's no system-wide interest on all the campuses on this private development? Do they talk about it? Do all the other campuses have similar?
Well, we also would like to have the ability to have a private developer to come on campus and build undergraduate facilities. And it's been difficult because we have the auspices of DASNY controlling what we do or not, and they are not willing to give us that flexibility. We have attempted to push it.
It would be great if cities supported it and pushed it.
It's a frustration many of these campuses are feeling, especially with the need to build more undergraduate housing on their campus and having to use DASNY to do all of it.
Okay, thanks, Karen.
Okay, thank you.
Before we take a quick look at the residence hall, Dr. Kinney is going to just talk about two quick things. One is the incident several weeks back at the Student Activity Center, and the second thing is the status or the lack thereof of the Toro Law School negotiations.
Okay, let me begin with Toro. Those negotiations, as you probably read, are off. They were never very seriously on, as I kept telling people. We had discussions with people from the law school, but we never got to any kind of negotiating table, and President Landers decided he really did not want to sell the law school. Subsequently, Kim Laval and I have been talking about creating our own law school on this campus, which is something that first came up in the 70s and came up again in the 80s. And we are moving ahead to see whether that's possible. Ken has even less patience than I do, which is wonderful. So he's ready to move in a hurry, and indeed so, as you know, so am I always. So we will see about that as a possibility. There's only one law school in SUNY, and that's in Buffalo, so there's really no conflict there. But anyway, that's where that lies at this point. The other thing I should mention to you is the gun scare. The other day, somebody stole an item of food from the SAC cafeteria when the students told me it was a piece of pizza. I had never heard the official, and went running out, and one of the people who worked for Chartwell's, the caterers there, tried to stop him and took chase and said he thought he had a gun. So what do? You know, there's only one thing you can do these days, I think, which is overreact and take it very, very seriously, which we did. We had a system to send out messages, instant messages, email, for those who had signed up for the telephones. The cell phone, had given us their cell phone numbers, which was about 11,000. It went out on the cell phones, it went out to 29,000 people on the email, et cetera, et cetera. There were a couple of glitches. One was it did not get up on the web as quickly as it should have. But at any rate, you know, if you don't know if there's a man with a gun and if he's inside or outside or where he is, you can't say do this or do that. You can just say be aware. As it turned out, he did not have a gun. It was the whole thing, there was no immediate danger whatsoever, thank the Lord. And what happened, you know, from one point of view, is that you got to test the system. We have invited people to let us know their suggestions for improving it, and some good suggestions have come in. The emergency management team met the next day. We have a new head of the team that we just hired who's very good, and had their own suggestions for improvements. We already had a siren that's been ordered but not installed yet, which will just tell people, you know, something's going on, check. So it's a good story, actually. It did give us a chance, in fact, to test things out. The other things that people don't understand is there is no way you can do a lockdown on a campus that has 30,000 people in it. There's no way you can inform everybody unless, you know, all those people who may be on campus who are not part of your system for informing them. The siren will help at least suggest there's a problem. But the notion of a lockdown is just unworkable. And I mean, you've got, you know, 200 buildings and 30,000 people. And if you had one building, you could lock it down. You can't lock that down. So I think that actually it was a good thing for us. I think we did learn from it. A lot of people reacted with appreciation that we had moved ahead. I kept thinking about those people off campus who heard about it and had kids here, because my brother in Waco, Texas, heard on CNN and I think it was NBC, one of the networks, and, you know, immediately called me. So you can imagine the parents who were hearing that there was a problem here. There were TV, helicopters, trucks. We had a press conference that you never saw so many reporters and cameras.
That was an expensive slice of pizza.
But you can't not take it seriously these days.
No.
So.
No, it was absolutely correct. Okay, now, I'm sorry, John.
Sure, you might want to mention Stony Brook Day. I was pleased to participate with that. It was
Oh,
so successful.
yes. We took 1,000 people, mostly students, 22 buses of people up to Albany to lobby. And it was wonderful. It is, I think, the best learning experience the students could possibly have. We go in groups to see the various legislators. The students do the talking.
Marching band.
We had the marching band there. We had a big party at the end, and a number of the legislators joined us there. And give us your views, John.
Well, it was very exciting, number one, just to get it organized to the point where we could all leave in a timely manner on a 6 o'clock actually in the morning, get there on time, and whoever, I know Janice had a great deal to do with it, with a lot of others.
Janice
Had to
is
schedule
the
a
man.
visit, the schedule of visits. And with the crowd and the security arrangements in the Capitol, it was incredible that we got to see everybody in a timely manner, and the whole legislature, Senate and Assembly, and the governor's office, we met with people from the governor's office. It was just a very, very successful and very well executed trip to the legislature.
Charlie McIntyre, sitting over here, is one of the people. The first year I was here, we brought how many people?
16, I think it was,
16.
in a converted van, I think.
And now we're up.
I just remember the year I was able to go, the comments, more than one, that I heard from legislators, not necessarily even our own, that Stony Brook puts on the best show of any, school that comes up there on the lobby days. They said, you guys like overwhelm us, and they don't forget that, that leaves an impression how many people show up.
There's a lot of energy and excitement. That was also there.
It's interesting too. One of the groups we visited, the legislator, was more private school interested, but his question to the students was, Buffalo wants $50 million to build a stadium. Do you think we should give it to Buffalo? That was his question. And that got a good conversation going about the power of athletics and the significance, and then how important it's been to us.
That's a great opportunity. I missed the last time here, but having on both ends, sitting as an assemblyman and watching the reports come through and trying to be totally prepared, and then as a Farmingdale professor going up with a busload, it really gives you an interrelationship with what the university is all about, And some of those questions are really helpful to the legislators.
It's a great day, so we want all of y'all to come next year.
If no more questions, business, move to adjourn.
So moved.
Second, commencement, please, start at anyone who could be there, everyone who could be there, please make an appointment, and,
May 16th is our next meeting. May 16th.
oh, yeah, it was the meeting before, okay, May 16th, I'm sorry, I apologize.
If you're interested in the tour,